Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 49 new cases of COVID-19 in Windsor and Essex County. 21 are close contacts of confirmed cases, 8 are community acquired, and 20 are still being investigated. We have had 15,434 cases since the beginning of the pandemic. 434 people are active at this time, and 143 active cases are having the variant of concern. 884 preliminary or confirmed variants of concern have been identified in Windsor and Essex County, with 90% of these cases having the UK variant, 2 cases having the South African variant, and 3 cases having the Brazilian variant. 17 people from Windsor-Essex County are currently in the hospital, and 3 people are in ICU. Our community has lost 414 people to COVID. There are currently 16 active outbreaks in Windsor and Essex County, 12 workplace outbreaks, 2 community outbreaks, 1 long-term care home, and 1 school. Regarding our vaccine update, 165,229 doses of the COVID vaccine have been administered to Windsor-Essex County residents. 151,398 people have received at least 1 dose. People 55 years of age and older are now able to book a vaccine appointment at one of our mass vaccination sites. You can book an appointment online at wevax.ca or by calling 226-773-2200. Priorities also include those living in hotspot postal code areas, who are 40 years of age and older, those with medical conditions, licensed daycare workers, and healthcare workers. We will be hosting 2 pop-up clinics on Monday for people 18 years of age and older living in the N9A and N9C postal code areas. Essential workers who cannot work from home and are working in a N9A or N9C area on Monday will also be able to receive the vaccine. You must show proof of address or work ID or a pay stub. This is a walk-up model only with no appointments. We will start vaccinating at 9 a.m. until 4 p.m. and we'll vaccinate until we don't have vaccine, and anticipate that we will be able to administer about 1,000 doses across both of these sites. The locations will be shared on Monday. We would also like to remind residents that individuals 40 years of age and older can be vaccinated at one of the participating pharmacies in Windsor and Essex County. Please see our website for the map of pharmacies at wechu.org. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. We'll go straight into our epi summary for today. So looking at cases across the province, as you can see that we have achieved the peak of the 3rd wave, and now the curve is starting to slow down, and the cases in the province are starting to slow down after a long time of being in that height. My apologies, I'm stuttering a little bit. Comparing our rates with Windsor-Essex, as you can see, similar picture. We are starting to see some decrease in the cases, but still it's a very early sign based on the last week worth of data, and we definitely like to see that trend continue and turn to go down. But clearly we are following the similar trajectory as the province, and the cases are showing a decline in the region. Putting all those 2 slides together, so provincial average, what the picture looks like, a much sharper decline in the number of cases, whereas in Windsor-Essex, it's just the beginning of these cases starting to go down. Looking at our week-by-week case rates, so last week we were at 92 cases per 100,000 population per week, and now we have dropped a little bit down to 91.6 per 100,000 population for the complete week. But if you're just looking at the last 7 days worth of data, our case rate is at 82.9%, so slightly improving, but still at a much higher level than where we like to see. Comparing those data with our wastewater surveillance data, so those data are still aligned very well. We're seeing a stability and also maybe potentially some decline, but again, those are just the early indication, and this is also a research at this time, and the data needs to be validated. Our percent positivity data remains unchanged from the last week. In total, we have completed 329,194 tests. That was completed as of April the 24th, and our percent positivity is stable at 6.5%. Last week, we completed approximately 5,739 tests. Our percent positivity across compared with the rest of the region, so we are almost close to the middle of the pack where we are with respect to our percent positivity. And if you recall, in our second wave, our percent positivity was one of the highest in the province, and now we are in the almost in the middle of the pack with many other regions with a higher percent positivity. Breaking it down, the percent positivity by age group, still the 0 to 17 age group continues to have the highest percent positivity compared with the rest of the age band. Breaking it down further, within the younger population, the majority of the percent positivity number is driven by the 14 to 17 or the high school aged children in that age group. The data with respect to the school-age children, and again, it went up and now starting to see some stability in the cases, but it's all relatively early to identify a trend, but we are seeing some stability in that age group as well. So comparing our cases with the overall cases versus just the school-age children, and here we can see that as we are seeing the overall cases are starting to show some slight decline. The school-age children, it's mostly stabilizing and not showing a trend to go down at this time. Overall, our case rates are now at fourth highest in the province, and if you recall, a few weeks ago or maybe a month ago or two, we were at the highest, had the highest case rates, and now we are slowly trying to improve in that sense, and there are other regions that have a higher overall regional and provincial rates. Breaking it down by each of these municipalities, starting from April to present, so this is just this month worth of data, and this month majority of the cases that we have seen by rate is from the city of Windsor, followed by Tecumseh and Lakeshore, when the rest of the municipalities are relatively stable. From just the distribution perspective, the last month, starting March 30th to April 28th, 2/3 of the cases are from Windsor, and the other significant municipality continues to be Lakeshore with 9% of the cases in the last month. And even breaking it down further to just last week, similar picture, Windsor constituting almost 70% of the cases, and Lakeshore and Tecumseh with 9% cases each, while the rest of the municipalities are at a fairly low level of COVID cases. With respect to age and sex distribution, as we can see, in the last 2 weeks, most of these cases are coming from the younger population between 0 to 30, and the rest of the population are relatively stable between 30 to 60, and very few cases in the elderly population. From an exposure perspective, not much change. Similar picture, close contact, household contacts continues to be the most significant mode of transmission, while it's still roughly around 30% of the transmission are coming from the community. And that's in the event of variants of concern circulating in the community, identifies the importance of taking all these precautions when you're out in the community. When looking at how the epi curve just for the variants of concern, as you can see that this curve is increasing with the new cases that are coming into our region are mostly the variants of concerns, constituting roughly around 50 to 60% of our daily cases, which is a pretty significant number. Just a word of caution on this particular graph, the last few days worth of data may not be accurate and subject to change because we do get the VOC results a few days after the fact that we receive the data. With respect to the source of acquisition, specifically for variants of concern, similar to what we are seeing for the rest of the in the community, and just trying to look at if there's changing by week to week or every 2 weeks with respect to the overall acquisition source. So looking at this, our community acquired rates just gone down slightly in the last 2 weeks. It's not significant enough, but still a slight decrease in that number with the household contact increasing. And as we know, these variants of concerns spread very quickly in an indoor setting, and especially the close contacts, household contacts are more at risk with all these variants of concerns. Looking at our COVID-19 hospitalization data, we have seen that our hospitalization number is increasing, and it's partly because of the transfers that we are receiving from other area hospitals. This is more pronounced with respect to our ICU bed utilization, and as you can see, our ICU bed utilization went really up, and mostly because of the transfers that we are seeing from out of region. Unfortunately, those who died as a result of COVID, just the breakdown of them by age, majority of the death happened in the 80+ population, and our youngest person died in the region was a man in his 20s. Overall, our case fatality rate is higher than the provincial rate, but a lower fatality rate in the long-term care home and slightly higher in the community fatality rate. Our day-over-day doubling time continues to improve as our case rates are decreasing in the region, and we are still way above the provincial and the federal rates. Our most recent estimated median R0 is 0.94, and this has decreased from last week. When we were slightly above or close to 1. And as we've explained earlier, when the R0 is less than 1, that indicates that the transmission is decreasing in the community, and a sustained decrease in the transmission would definitely help to bring our case rates down. So now looking at our COVID-19 vaccine data, and a total of 167,822 doses have been administered, and I'm not sure that if that's the 28 data, and Teresa has given you the most recent data, so I won't quote the number, but this is what it looks like. On an average, in the last week, we have given more than 3,000 doses in our region. With respect to the dose 1 and dose 2 administration, we know that because of the increased dose interval, most of these doses that we are administering is only for dose 1, and that's it's dominated here in this graph. With respect to our coverage rate, as of April 28th, our coverage rate for the region is 33.8%, and our 60+ coverage rate is 82.4%. So it's pretty impressive in terms of our coverage rate for our seniors, but definitely we'd like to see more uptake, and more seniors vaccinated would definitely provide them with a better opportunity to avoid any hospitalization or severity of the disease. In the younger ages, we are starting to see some increase in the uptake as we continue to lower the age brackets, either based on their area of residence or the hotspot status of or any other medical conditions that we are seeing. With respect to our hotspot coverage rate, we can see our overall hotspot coverage rate is not too bad. It's almost 30.6%, with the highest coverage we are seeing in the N9Y hotspot, which is well above our overall coverage rate. We are seeing some challenges in N9B and N9C area, and we are working with our health system partner to increase the vaccine uptake in that region. With respect to the location of these doses where it is administered, and majority of the doses were administered by the hospital-based clinic, and which was in operation starting late December and to date, and then followed by the mass immunization clinics that are being operated right now, with and a significant number of vaccine given out by the pharmacy channel. Pfizer vaccine continues to be our workhorse vaccine, with majority of the doses administered in our region is Pfizer, followed by AstraZeneca, and then a smaller portion of Moderna vaccine. Similar information put in by the cumulative doses by the vaccine, and as you can see, we got access to Pfizer earlier on, and we continue to have majority of the vaccine in our region coming is Pfizer. Daily doses administered by vaccine, we can see that all these vaccines are being uptake is pretty good, and including the AstraZeneca, and we have received some questions that maybe people are not getting the vaccine, but based on the information, based on the data that we have, we are getting the vaccine, and our recommendation has always been very clear: get the first vaccine that's available to you to protect yourself and protect your family. So in summary, the case rates in Windsor-Essex County remained unchanged, but starting to show some slight decrease, which is good for our region. Acquisition source is still the same with no changes, and up to 30% of the cases are coming from the community transmission, while the rest are from close contacts. Our hospitalization and ICU admissions have increased, but mainly because of the transfers that we have seen in our region. Our vaccine rollout continues to go on at a steady pace with the available vaccine supply, and our coverage rate continues to improve every day, with a lot of people getting vaccinated every day. With respect to the monitoring indicators, our most recent completed weekly case rate is 91.6 cases per 100,000 population, and our most recent 7-day rate is 82.9 cases. So obviously we are showing some improvement, but still we have a long way to go, and we hope that by the time when we get to the reopening rescind of the stay-at-home order, we want to be in a better position to open up for our region. Our percent positivity for last week was 6.5% for the full week, and just the last 7 days, it's also improving, and it's dropped down to 6.2%. Still very high, but hoping that it will improve. Our effective is at 0.94, and showing that the transmission is decreasing in our community, and it should continue in that positive direction. Thank you.
We'll now take questions from the media. Today we'll start with AM 800.
Hi, good morning. I'm just wondering, as we head into May this weekend, which is supposed to be the month that a lot of the provincial orders as it relates to stay at home are supposed to be lifted. So what are you hoping to see from residents in terms of entering into May as more people are vaccinated?
Well, we definitely like to see a decrease in the transmission rate, and with the variants of concerns, it is a huge risk. We know some of these variants do not respond well to the vaccine, and if the spread continues on, that means we are giving this virus an opportunity to further set a strong foothold in our region and lead to ongoing transmission. So I think with the increased vaccine rollout and with the stay-at-home order, we have the opportunity to even contain all of these viruses that are currently circulating in our community through community transmission. And if we get our case rates down, we'll be in a much better position to open up. And we know that there's lots of vaccine coming into our region in the month of May and June. We heard from the provincial announcement. So we will be in a much better position. The end is almost near, and I truly want people to please adhere to the public health measures so we can continue to get rid of this pandemic and move on with the rest of our activities that we like to do.
Looking at our current numbers, Dr. Ahmed, if the provincial government does not extend the stay-at-home orders and the restrictions, would you support that move and allowing some of the things that go with it, such as, certain businesses opening up more and stuff like that?
So I think we still have almost 3 weeks to see how the situation change. And as I quoted, our weekly case rate is still 82.9%. And if we look at our provincial framework, that means we are close to a lockdown anyways. We are well into the red restrictive zone. And that means that the risk to our community is high. I think it's just a matter of comparison. So when we are comparing ourselves with the rest of the province, yes, we are better, but we are not on its own in a position to say that we should open up and we should start having loosen all these restrictions. I truly hope in the next 3 weeks we'll be in a position, we'll have less than 50 or less than even 40 cases per week, 40 per 100,000 cases per week. And that would allow us to be in a lesser restrictive zone. So we'll have to look at the data when we in the next few weeks. And depending on where the data is, obviously, I want us to be as open as possible with the available restrictions to ensure that we are not contributing to the ongoing spread of the disease. But if we do better, I'm sure that there is a good case for us to make to open up more based on our case rates and our vaccination rates.
Okay, thank you.
Any questions from CTV?
Yes, good morning. The province is requesting tighter international border restrictions. Do you think that Windsor needs a quarantine hotel for our land border crossing?
Good question. I can't answer that question in terms of how many truly international traveler that we are seeing at our region. I think most of our people, as we all know, there's a good number of people that cross border for essential work reason. And I'm not sure that if we are seeing truly a traveler that is coming to our region. If that's the case, then it makes sense. But I can't comment that based on the number. I don't have those numbers.
Okay. And as far as the vaccine, the province does hope to have the 18 plus eligible by the end of May. Do you anticipate the same schedule for Windsor, or would this region be able to open it up earlier?
Well, I think we hope that we should be able to do that. It all depends on how much vaccine that we are getting, and we did some of our projections internally in terms of where we will be. We're hoping that we should be able to do that, and then that means anyone who is eligible can get the vaccine. We'll have to see what the next few weeks look like, but I'm confident that we should be in that position and follow the timeline that the province has set up.
And for the pop-up clinics, the 2 postal codes that you listed, what are the problems in those areas, or why do you think that those areas are at a lower rate than other areas?
Okay, so those areas, we know that there are a number of socio-demographic challenges. They're based on their education, income status, and access to healthcare. So there are a number of challenges that these neighborhoods have. Language could be a barrier. We know that there are the predominant language is not English. So we need to be in those communities to offer and to remove some of these barriers by providing them direct access. And we're hoping that with this direct approach, we should be making those direct connections and removing all those barriers for them to get the vaccine.
Okay, thank you.
Any questions from CBC?
Yes, further to my colleague's question about the vaccinations, the province said yesterday that adults in the hotspot postal codes are supposed to be eligible to book as of Monday, but I know that isn't our plan locally. When do you think that might happen?
So just a clarification, it's not Monday, it's the week of May 3rd. So that could happen anytime during the week. We don't know which date, so just that clarification. we'll have to look at our data and we'll have to look at our vaccines, how much of these vaccines are available for us, and then we'll make the announcement. We would like to move forward as quickly as possible, but if we don't have enough vaccine, we don't want to move too quickly and then cause more frustration in people that they are eligible but they cannot receive the vaccine. So it's just that fine balance, but we're hoping, as I answered before, to follow what the province is suggesting by looking at the vaccine uptake and the available vaccines that we have.
Thank you. I also wanted to ask about those cases of the variant first found in Brazil. Were these cases related to travel, or do you have any details about these cases and what we know about this particular variant?
So without sharing lots of personal health information, the only thing that I can say is that we do have some evidence of a travel with one of the case, and then there's another case that we cannot pinpoint how they acquired the disease. So our team is still working on it and trying to get as much data as possible to try and identify all the individuals that could be at high risk to limit further transmission, but it's a work in progress.
Thank you.
Any questions from Blackburn?
Yes, I'm sorry this was already addressed, got connected for but the location is going to be announced on Monday. Sorry, it's not clear.
Sorry, can you repeat, Maureen? You kind of came in and out.
Okay, just the pop-up clinics, they're supposed to be on Monday, but you haven't released a location, is that correct?
Yes, so on Monday we will release the locations because they're specifically for people that actually live in the area or are essential workers working that day. So it won't be something that we want to invite people from all over coming to the area. It's people that actually live there and would be able to be in close proximity to the vaccination sites that we'll announce on Monday. And in the background, we are working with some of our partners in the community to make sure the residents in the areas are aware of this opportunity.
Okay, and so what time is it supposed to start on Monday?
The vaccination clinic will be starting at 9 o'clock and will go till 4 o'clock unless we run out of vaccine. But we hope to have about 1,000 doses available across both sites. So there will be, a site in the downtown area and one in the West End area. And probably the downtown site will have more vaccine and the West End area will be a little bit smaller.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Teresa, is it 1,000 doses between them for a total of 1,000 doses?
And I'm saying 1,000 just based on the space and our initial plans. We wanted to be outdoors and we thought we would do more people outdoors. And because Monday, the weather is not going to be very conducive to being outside because of it'll be raining. And so we're moving both operations will be inside. So today and tomorrow, we're looking at both locations to determine what a good safe flow would be. And so right now we're thinking the West End location could probably accommodate around 300 people through that location. And the downtown area, maybe up to 700. It might be less once we're out there today looking at it more closely, but we'll do our best to move the vaccine, as much vaccine as we can, but it would be around 1,000 doses for both areas combined.
Can you give us a sense of what this is going to look like here? Are you going to have people outside managing the line? Tell me what it's going to look like.
So we have We have all of our staff that have been working in the mass immunization clinics, and our own internal staff across from our tobacco and vaping enforcement officers, our facility people, will all be working at both sites that day. Our IT staff, like I said, our vaccinators, our managers, and will be helping with the flow. So the intention is for people to be able to walk there. It'll be in a neighborhood area, walk there, or I know some people will drive, but really it's a walk-up clinic, get your vaccine, there's no appointment. We will have some of our own staff translating as well that have the ability to speak other languages such as Arabic, Mandarin, and Spanish. So we are using our staff. There will be lots of people to man the lines. We are looking at a system that will give actual, if you're in line, you'll get a ticket or something kind of saying where you are in line, and be able to come back and kind of secure your spot. So we don't know exactly how it will look. It seemed to be a little bit, there was more room if we were going to be outside. So we'll see how this goes, and hopefully the lineups aren't too long, that people that are living in that area and those that are working, essential workers working that day that are able to come for a vaccine are able to do so. But we are just, trying to provide this other opportunity for vaccination where, as Dr. Ahmed said, decreasing any barriers, if it is transportation, language, even the ability to book online or to get to a vaccination site. This is right in their area, and hopefully people will take advantage of it. And obviously we want it to be successful and don't want people to be frustrated with long lines, but we really don't know. We've talked to our counterparts in other areas, and we know what others have encountered, and we're going to do our best and try this.
Hello?
Hello? Taylor?
Sorry, I thought it cut out there. Okay, so it sounds like you're gonna have some sort of ticket system in place, maybe something to prevent the kinds of lineups that we saw in the GTA, where people were waiting and the doses had run out by the time they got to the front.
That's our plan, and we are planning again today and all through the weekend to try to make sure we address everything. But that was our plan, is some indication of where you are in your lineup to avoid having to wait. And this isn't Toronto, so the volume of people is at a different scale. That's why we're really focusing on those postal codes and ask people to respect the two postal codes, the N9A or the N9C, and try to give people that live in that area access to the vaccine. Otherwise, that would, they wouldn't be able to necessarily attend a clinic easily. And also any essential workers that are working that day. So we don't want people to make a purposeful trip to go downtown to get a vaccine because it's available. We want it to really meet the needs of those working or living downtown on Monday, May 3rd.
And finally, can you give us any more information about the kind of outreach going on right now to let the people that live and work in those communities know what will be happening on Monday?
Well, we do have partners, community partners, and we have another meeting today, and they'll be using their networks to reach out to people. And we'll also be sharing more details with our councillors that have constituents in both areas, and having them, do some social media on, I'm going to say Sunday, as we get closer. And then on Monday, we'll be announcing it as well. And Mike, Janice, and I have talked about how we would share it with our media partners, and so that you have an opportunity to attend as well, not necessarily inside, but be able to know the locations. But we just don't want people gathering, as we've seen in other areas, through the night or anything. We will have lots of vaccine in Windsor and Essex County through the month of May, and we want to really see how a pop-up clinic works in an identified neighborhood.
Thank you.
Any additional questions from AM 800?
No, I'm good, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes, have you heard of people taking taxis across the border, like flying into somewhere near the border and taking taxis across in order to avoid that hotel quarantine?
Not to my knowledge, we haven't heard any of these stories here, and I'm looking at my niece as well. It seems like we haven't heard any calls or any other information. So not to our knowledge. I know that it was in the news about the Niagara Buffalo border, but not to my knowledge here in Windsor.
Thank you. And do you have any comment on our mayor crossing the border during the shutdown?
I'm not sure what kind of comment you are looking for.
Well, given that the border is closed and we're all discouraged from crossing.
Well, we do have that message, but understanding that the mayor already provided an explanation for why he crossed, and some of these decisions, obviously, it's very unique and based on the individual situation. And our general message continues to be the same, that we definitely want people to stay home and do not leave for any reason unless it's essential, and that's all I can say.
Thank you very much.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yes. Have you received any indication that the local vaccine supply will increase again after the May 3rd and May 10th weeks to accommodate getting to the 18 plus age group by May 24th week?
We do know that after May 10th, that the doses of about 22,000 will go to, they'll decrease to about 17,000. But as you know, we are making really good progress with our vaccines. So we would, opening up the age bands is something that we are quite excited about, because it will move the vaccine very quickly. And from all of the meetings we've had with the province, there seems to be lots of vaccine coming. And I'm not going to say that everyone will be vaccinated by the end of May, but it will be opening up, and we're happy to have it opened up. And our plan has always been to work toward vaccination for everyone by the end of June, like for the first doses. And so we're really on track for that, and we'll move as quickly as we can with whatever allotment we're given. So we're happy with what we've been provided right now. And as you know, we're also using pharmacies, primary care providers, mobile clinics. So there's other avenues and other people assisting with the rollout. So we will continue to do what we can to get everyone vaccinated.
And when the booking opens up further to more eligible groups, do you think that the booking system online will remain the same, where you can go get an appointment for 1 or 2, 3 days from now, or maybe expand it to like a week or so, or will it maybe return back to a pre-registration system like we saw earlier on?
I don't think we're intending to go with a pre-registration system. We are on our own system right now. We're not on the provincial booking system. Those conversations continue to occur within our health unit to make sure we're able to utilize a booking system that meets our needs. And if at some point the provincial system is the one that seems to work well based on the age bands increasing, then we'll explore that as well. But I think that right now, we monitor all of the openings very carefully, and, you know, we've always been looking at that next step. Okay, we have some spots. How do we get people to be able to, you know, fill those appointments? And it really is opening up other opportunities, whether it's essential workers or the age band. So we'll continue to monitor that, and I don't think right now we're worried, but you know, we'll continue to monitor it and assess what we need to do. But I don't think we're really wanting to book too far out. And as you know, come June, sometime in June, we'll be starting second doses. So we're kind of, you know, balancing everything right now.
Finally, do you know if the teleconference will happen on Monday with the pop-up clinics happening as well?
Our plan is to have, like, the YouTube session, this session. It's
correct, yeah.
It's to continue to have it, knowing that you may not, you know, that you may want to be somewhere else and not on the YouTube session. But we'll announce it here. We'll announce you know, our numbers and everything. And you know, if you're saying you want to cancel, we can cancel on Monday to give you an opportunity to be elsewhere.
Well, we'll see what happens. Thank you, Teresa. I appreciate it.
Okay.
Thank you, everyone. Have a great weekend.